The London Care Record, to put it at its simplest, is a way of connecting all the various bits of a patient's record in all the institutions and organisations across London, so that a clinician looking after a patient can see those at their point of care.
From a frontline staff perspective, this allows them to have confidence that they have got the right to access that information, but also that any patient objections have been considered previously.
The big difference is where we're not repeating things that have already been done, not sending people in necessarily where we don't have to.
It's literally one click and I'll be able to get access to the patient's appointments at the hospital, and that's just made life a lot easier.
We've all been there where we've treated a patient and we've come away at the end of the day thinking, was that the most appropriate place to take the patient? I wish I knew a bit more. And actually what we've got is the ability to have that information to make the decision, which makes it a much more comfortable decision.
Through this system now, I've got full access to see when the next appointment is, and that's really helpful, just to be able to give people a reminder if we're seeing them for something else anyway, just do you know it's just next week.
When a clinician is viewing a shared record, it's important that the clinician has access to information that they need to access in order to fulfil that role. The role-based access model allows the controls to be in place to allow appropriate access.
And pretty soon we'll cover all 9 million population, which will be remarkable.
So the data sharing framework that we've set up for London supports integrated and consolidated management of data in a safe and robust manner to support direct care, research and planning.
I think having the sort of framework across London means that all professionals, all clinicians and all patients can sort of feel assured that their data is being used in a consistent way across all the providers across London.
I think the really crucial thing to remember as a patient is I can only see your data if I'm allowed to see your data.
The Citizens Summit gave us a really important starting point for the strategy. That mandate to join up health and care data across London to improve Londoners' health was very much the starting point for everything that we've done with the strategy.
For the flu and COVID vaccination programmes, we're using the anonymised data to help drive where we do more take more action to improve uptake.
We have a project that's ongoing at the moment looking at joined up data between one of the hospitals in our Cancer Alliance and the surrounding general practices of patients that we know had lung cancer at that hospital over the recent years. And we're trying to see if that can show us opportunities for earlier diagnosis.
So it's all for me about trust and trustworthy behaviour, and for the public to have confidence. When we reach a commitment through a deliberative, structured event in the way that we did, we've really got to try very hard to deliver on it.
The strategy was declared to include robust and progressive citizen engagement to build trust, and that's an important word we'll probably come back to build trust and ensure that we are operating in line with citizens' expectations.
You've asked Londoners for their views and you didn't waste our time. And we gave up a lot of our time, and we're just hoping that you took it all on board and was able to roll it out.